Hey guys, it's Hink here. Today I want to touch on a topic I get asked about all the time, and that's basically how to last longer in bed. Today we're going to discuss premature ejaculation, go through what the literature suggests about it, and also some helpful tips on how we can all last longer, okay? And so stay tuned. I think this is a pretty good one. So today we're going to be using primarily two resource articles as our source of inspiration. So one is actually this clinician review for the general practitioner, which actually comes out of Australia, which is just phenomenal. And then the next link is actually from the International Society for Sexual Medicine guidelines for the diagnosis and treatment of premature ejaculation. So both of these are two heavy-hitting articles. This is mostly about premature ejaculation in these articles, but there's, even for the guys who just want to last longer, there's a lot we can all gain from this. And so first of all, why do we care? First of all, I think it's important to know what's normal and what's not for our overall mental health and dysmorphia, because a lot of guys within an average range probably think that they are premature. And so, for example, the average time from penetration in the vagina to ejaculation is actually about 5 to 6 minutes. In some countries, it's even less than that. And so it's actually much quicker than you might think. So don't get fooled by these porn stars that seem to be going for hours and hours and hours. A lot of that is cutting and, all kinds of stuff, which we can discuss later. And so if you think you might be premature, what you actually need to do, I know as silly as it sounds, is you need to actually calculate how long it takes you to come. Some people might think that it's actually like 30 seconds, when in reality, it's within that normal 5-minute range. The other thing is that for guys who are having sex with women, on average, it takes women about 2 to 3 times as long to reach climax, okay? And so it takes them on average about 14 minutes. And so we all want to maximize our potential in the bedroom, okay? Make sure our partners are very happy. Well, let's talk about some general background. And so today we're going to be discussing the other PE. So normally PE in my reference is actually talking about penile enlargement techniques. And so if you're interested in that, check out my other videos, but this is about premature ejaculation. And so how prevalent is it? Well, it's prevalent in about 20 to 30% of the population, depending on where you look, okay? It can cause significant psychological distress. And I think that's the most important component of actual premature ejaculation is the psychological distress with either yourself or your partner. It can also put you at risk of things like avoiding intimacy. You can be also a victim of, false advertisement, just like guys with smaller penises, okay? Just so you know, men care far more than their heterosexual partners about premature ejaculation. This has been proven in studies. So just like penis size, women typically don't care nearly as much as men do. But once again, average time to ejaculation is about 5 to 6 minutes. So what are some causes for premature ejaculation? Well, you can have it lifelong, okay? It can be sudden. It can be related to some things like a thyroid or prostate dysfunction, sometimes recreational drugs. Sometimes you can have higher sexual sensitivity due to the actual sexual stimulation itself, or even psychological triggers. And then there's things like anxiety, depression, stress, and trauma can all lead to premature ejaculation. And so there's actually a criteria for defining premature ejaculation. And so I'm not going to go through this. I don't want to take much time going through this, but in general, the lifelong premature ejaculation is basically since the first time you ejaculated inside a woman, it's been less than a minute, okay? Acquired is typically less than 3 minutes, but with the lifelong, it's actually very uncommon to have that component, and there's actually a genetic component to it, which we'll discuss in just a little bit. The acquired is something where it's typically less than 3 minutes to the onset of ejaculation. It can be even a new onset, something that is usually related to some sort of change, whether it be, once again, something like anxiety or trauma, or sometimes even things like prostatitis can actually lead to premature ejaculation. But then there's two other classifications that are very important. One is variable. Normally you last, well, let's say 10 minutes, and then all of a sudden you have sex with women and you last less than a minute, and you're like, what the hell just happened? Well, that is what you call the variable. It can be inconsistent. It can occur at any time in a man's life. Very, very common, okay? Usually this doesn't need any kind of intense treatment. And then there's also the subjective premature ejaculation, which I alluded to before, where you actually technically don't meet the criteria for true premature ejaculation. You just think in your mind you should be lasting longer, okay? I'll also link the studies below if you want to look into it some more. If you're interested, just basically pause the screen and just look at the study. So importantly, now that we know what is premature ejaculation, we need to know what it's not. And so it's not premature ejaculation if it only happens occasionally, if it's something like you're practicing semen retention or no FAP and you have your first sexual encounter in months, or if you feel like it's a short time but it's actually within the normal range. So now we need to talk about basically the pathophysiology, meaning what goes wrong in the human body to allow for this. When you have the lifelong premature ejaculation, which is less than a minute, that's actually an inherited trait. And when you basically don't have the appropriate serotonin pathway, so serotonin basically inhibits orgasms. And so if you don't have that appropriate serotonin inhibition, you're not going to be able to control your orgasm, okay? But you can also have conditions like prostatitis, hyperthyroidism, and even things like a hypertonic pelvic floor, meaning just an overly contracted, overly tense pelvic floor. And you can actually have this like cycle of both erectile dysfunction and premature ejaculation, where basically you have trouble getting hard. And so you train yourself to basically come as soon as you get hard because you know you're gonna not be able to maintain that erection. And so that's something that can cause it as well. And so how do you actually diagnose this? So as a physician, how would I diagnose this? Well, there's actually this validated tool that's called the premature ejaculation diagnostic tool, which is basically a questionnaire that the patient fills out. I'll put a little example of that on the screen where you can see that the patient basically answers questions, and based on the actual numeric score that they have, you can actually diagnose them with different grades of basically premature ejaculation. I would want to complete a complete history and physical, asking questions to rule out, for example, is it erectile dysfunction related PE? Is it lifelong? Or is it something like, oh, you have symptoms which suggest prostatitis, which we can treat? There's not really any good diagnostic imaging or diagnostic test for this. If you made it this far, guys, I would really appreciate giving this video a thumbs up if you've learned anything whatsoever or just enjoying it. So what is the management? There's something that's called psychological therapy, okay, or psychotherapy. It's kind of fallen out of favor just because it has an intense time commitment and it takes a very long time to get it. It's still a very good first line. And now, especially with all of these like better health, like online consultation services, it's actually pretty easily accessible and actually not as pricey as it used to be. So it is a good place to start if you're dealing with premature ejaculation, or you just think you're premature even though you're really within that normal range and are having some distress from that. There's things like behavioral therapy. That's things that you can behaviors you can change in yourself before sex. Like, for example, considering masturbating before sex. So that can put you in like a refractory period where you actually can't ejaculate again. And so, if you're fortunate enough to still be able to have an erection after orgasm, you can then engage in intercourse, okay? There's things like topical analgesics, meaning numbing agents. Key thing with this, guys, if you're going to use it, you need to make sure you use it with enough advance, meaning, you're gonna have sex, and so spray it. So that can actually interrupt the flow of sex. So that's why it's not used as much, but also you need to use a condom if you're going to be using this form, because you can actually make your partner's genitals numb, which can make sex bad for everybody, okay? And so just make sure you use a condom if you're gonna use that. One of the most effective methods of treating this is actually pharmacotherapy. And so guys, this is not just if you want to last longer, this is what guys with real premature ejaculation. If serotonin basically helps to inhibit ejaculation, if you have drugs that can increase serotonin, like tricyclic antidepressants, TCAs, or even selective serotonin reuptake inhibitors, or SSRIs, they can actually increase your serotonin, increase your ability to actually last longer. We're not really using TCAs to treat this anymore, and so we're using mostly SSRIs. They actually did a randomized trial to say, which of these methods is actually the best, okay? And basically what it shows is that it doesn't really matter. They're all good and they all can increase patients lasting longer, okay? One of the ones I've seen with the most data is something called paroxetine. It is actually approved by the FDA for use in the United States, at least. The only problem with it is it has a buildup period, and it's not like popping a pill like Viagra if you want to have if you know you're going to have sex and want to have a good erection. Good news is you don't have to really like prep to use it, but the bad news is like if you want to have sex and you just got your prescription of paroxetine and you take it within an hour before, it's not going to make a difference. It has that buildup period. Duloxetine is actually an oral medication that's similar. Now that's like a Viagra where you can pop it before sex and it'll actually be effective, okay? You got to be aware though, all of these drugs have significant side effects. In some cases, they can actually just destroy your libido and even make it so you can't have an orgasm or anorgasmia, okay? So that kind of defeats the purpose. And there's also costs. Some insurance companies have problems approving this for actually premature ejaculation, but that's come a long way. I'll put a few tables up. There's some really good studies of basically drugs and how they're effective, the doses and the side effects. And so I'll put this in the link below, but there's some good resources on here if you're interested in drugs. One thing that actually surprised me is there's an opiate drug, meaning there's something that's in the same family of morphine, which is called tramadol. And so typically when I prescribe it, it's for actual pain purposes, but it has been proven to be effective as far as preventing premature ejaculation. You just have to be careful because number one, this is only used in refractory cases to SSRIs. So this is kind of like a last resort type of thing, but it has a very high addictive potential. And of course, all the side effects that come with opiates like constipation, addiction, a litany of other things. So how about PDE5 inhibitors? You guys probably have seen my videos. I'll put up a little blurb and a little like blurb so you can click it, or at least after the video, I'll put the link in the description. But I made a whole video series on PDE5 inhibitors and why I think they are so important when it comes to men's health, penile health. They actually have very little efficacy here. The only case, as you probably guessed, is in patients that have the premature ejaculation related to erectile dysfunction. And so in that case, if you can get them a better erection, they don't feel a need that they have to ejaculate quickly before they lose their erection. Pelvic floor therapy. I think the pelvic floor doesn't get enough respect when it comes to its implications for premature ejaculation in the hypertonic pelvis. And so I'll go into that a little bit more. Finally, surgery. In general, there's no role for any kind of surgery for premature ejaculation. There's very limited evidence that things like a circumcision, if you're uncircumcised, can help. I would never recommend this option, but talk to your surgeon, talk to your urologist. If you really have this problem, it might be appropriate for you. They're researching things like dorsal nerve cryoablation. So basically, that's exactly what it sounds like, meaning the actual nerve gets basically frozen to limit the sensitivity. Hyaluronic gels inside the actual head of the penis, and also Botox into your pelvic floor muscles like your ischial-cavernosus muscle and your bulbospongiosus muscle to physically prevent you from being able to ejaculate, okay? So what do you want to avoid? You want to avoid Kegels. Guys, Kegels are the bane of my existence. And all of these, websites and blogs, it says, oh, Kegel, Kegel, Kegel. Guys, you Kegel enough. Trust me, if you're a normal man, you Kegel enough, and you don't have a weak pelvic floor unless you had surgery or some kind of trauma. And so what happens is you are literally training those muscles that are used for ejaculation to work even better by strengthening them and tightening that pelvis into something that we call a hypertonic pelvic floor, which can cause things like premature ejaculation. Like, for example, when you Kegel, you're working that bulbospongiosus muscle. The bulbospongiosus muscle is the one that actually contracts when you orgasm in a pulsatile way that actually forces the semen out of the penis. So why would you want to strengthen that muscle when you're trying to delay that action? And so I strongly disagree with any kind of website or blog that says, oh, men do Kegels for premature ejaculation. Strongly disagree, okay? And I'll go into what to do instead, but I would not recommend that you do these, especially if you have other symptoms of a tight pelvic floor that can be associated with things like sometimes even difficulty urinating, difficulty with constipation, or even just pain in the pelvic floor, especially with ejaculation. So what do you want to do instead? You want to do something that's called reverse Kegels. And so instead of actively clenching, you actively try to relax. And so what does that seem like? Well, imagine that you are sitting on the toilet and you're about to have a bowel movement, and you kind of push out and you can actually feel your pelvic floor actually sink down. That is a reverse Kegel. If you also think you're standing in front of a urinal and you're relaxing that pelvic floor to get that strain of urine to come out, that is a reverse Kegel. So I'd recommend if you're going to practice this, practice with an empty bowel or empty bladder. But that's a reverse Kegel. And so if you actually practice doing this relaxation technique, it can actually help reverse premature ejaculation. And not only that, you can train yourself to physically make yourself relax. If you are on the verge of climax, whether you be masturbating, having sex, or even something like oral sex, practicing something like a reverse Kegel where you physically relax that pelvic floor, you will be surprised how effective that can be. So what are some tips and tricks for basically how to last longer? One cheat is to basically wear a condom, okay? Never stack multiple condoms. That can lead to breakage, increase STDs, pregnancy, things like that. But wearing a condom can help. Masturbating prior to sex, once again, you get that refractory period. It's especially effective in younger men, which have a shorter refractory period and can maintain an erection. Older men with erectile dysfunction issues, that can be more of an issue. You can try the stop and start technique where you literally, you feel an urge coming and you just stop. Wait about 30 seconds and then resume, okay? The squeeze technique, which is basically like the start and stop technique, but instead of just stopping, you actually remove your penis from the vagina and actually put pressure basically just below the glands of your penis, and you hold that pressure for about 30 seconds and then you stop and then you restart again. Obviously, that's very interruptive to the sexual dynamic, but it is very helpful for some people. Like I said before, practicing reverse Kegels, whether you be masturbating or doing any kind of sexual stimulus, even if you just find yourself getting aroused, try practicing reverse Kegels and physically training yourself to relax those muscles, and you will be surprised what that can do. And then there's also pelvic floor relaxation techniques and stretches. If you haven't seen my video on, not my video, well, I made a video on heart flaccid, guys, which does incorporate some of these techniques, but also there's this amazing video. I'll put up a little screenshot here and I'll put the link in the description below. But it's this gentleman who made this like pelvic floor stretching routine, and it is money. And I do that almost every night, even though I'm not having any problems. It's just helped my sexual performance so much and blood flow, erections, that I continue to do it. And then the last thing, guys, is just take it slow, okay? Once again, on average, it takes women about 14 minutes or 2 to 3 times as long as it takes us to reach orgasm. So if you're engaging in sex, take it slow, allow time for appropriate buildup and arousal. And pro tip for guys that are having sex with women is that if you can maximize their arousal before penetration, you're going to maximize the chance that you are successful in helping them not only achieve an orgasm, but achieve an orgasm quickly, okay? In closing, guys, thank you so much for watching. Please consider subscribing or liking this video. All that goes a long way in helping the channel grow and getting this message out. If you need to reach me directly for any reason, my Patreon, DocHink, is the way to go about that. Please check out our supplement company, LeviathanSups.com. Also check out Vigor. We have Virility, which is coming down the pipeline. We've had a few setbacks with that, but it helps with overall semen volume, semen health, and even semen taste, believe it or not. But do your own research. I'm not an expert in this, guys. I just find the research that I feel is appropriate and helps get this information out. But until the next one, guys, peace and love.